Hi, my name is Chelsea Carter, and I am a current Master's in Health Science student at Meharry Medical College on the pre-medical track. And today, my research project is on community mental health centers and treatment approaches' impact on mortalities associated with mental and behavioral disorders in the state of Tennessee. Previous research argues that community mental health centers have a stronger impact than state hospitals in administering mental health care to the general population. This is because it allows patients to interact with the community, still have their friends and family close by without ostracizing themselves just for the sake of getting care. All right, so since deinstitutionalization in 1967, there has been an increase in community mental health centers that allows people with mental health disorders to maintain daily interactions with family and friends. But this still does not address the inequities such as access and cost. So Tennessee is ranked 45 out of 51 in access to mental health care when 9 different measures are assessed. These measures can include not receiving treatment, having unmet needs, amount of uninsured patients within the population, adults with cognitive disabilities who cannot see a doctor due to cost, and mental health workforce availability. All right, so community mental health centers introduces different treatment approaches, allowing for more patient-centered treatment options such as different drug options and therapies. All right, so with all this provided information, I was interested in the trends in treatment approaches over the years, and I also wanted to explore as those community mental health centers are added in the state of Tennessee, how have the treatment approaches shifted? Is there a negative correlation between mortality rates concerning deaths due to mental and behavioral disorders and the addition of community mental health centers? And really, what are those trends over 4 years? So the 2017, 2018, 2019, and 2020. So unfortunately, we have to fail to reject the null hypothesis as our sample did not provide sufficient evidence to conclude that a significant effect did exist between the community mental health centers, increasing amount, and the mortality data that was associated with mental and behavioral disorders. The increase of community mental health centers, however, over a 4-year span, so that 2017 to that 2020 range, showed a strong negative correlation with the percentage of deaths caused by mental and behavioral disorders. So it seemed that one did go up while the other one did go down. But however, according to the Pearson's correlational test, there was no significant difference between those two variables. Okay, so the inverse relationship of the community mental health centers and mortality associated with mental and behavioral disorders. However, we did find a statistical significance between the mental health providers per patient ratio and the behavioral disorders mortality rates. So there was a positive correlation between those two variables. Again, the variable of the mental health providers within each county and the deaths associated with mental and behavioral disorders. So also in that results section, I put 3 graphs that are talking about the different treatment approaches over that 4-year span. They include telemedicine, also known as telehealth therapy, those psychotropic medications, and activity therapy. So all of them seem to be increasing over the years steadily. However, activity therapy in 2020 did decline. I possibly believe that that is because of COVID. Again, not as much hands-on interaction between therapist and patient. Of course, social distancing and things of that nature. In conclusion, as those community mental health centers increased over 2017 to 2020, the numbers of deaths associated with mental and behavioral disorders have decreased, but not at a significant rate. Further research should explore if the geographical placement of these community mental health centers would better address that discrepancy. The more mental health providers present to accommodate the county's population, the less deaths that did occur. We found that from looking at the county health data, which unfortunately the county level data was not available for those community mental health centers total. And I feel like if that was an accessible tool, definitely would have been able to look deeper in to see where the placement of these community mental health centers and see if that impact would have made a difference. All right, so since those community mental health centers are the second facility type most used from 2017 to 2020, we can conclude that this trajectory has contributed to increasing the mental health provider ratio in counties across Tennessee. Again, so as we're adding more and more mental health providers in areas, we are seeing a decrease in deaths associated with the mental and behavioral disorders. So again, limitations, since the NMHSS has only been distributed since 2017, limited data has been obtained to support the hypothesis. I would like to see what this looks like in 10 years when you have a bigger sample size, and also looking again at those county level trends. So that is it. I am looking forward to answering anyone's questions during the day of our presentations. I want to give a big thank you to Dr. M for giving us all of this knowledge behind statistical data analysis as well as researching. And again, I also want to thank you, my colleagues, for supporting me during the completion of my project. Thank you.